Choice Home Care and Hospice present Choices to Benefit the Aging with your host, Joe Urrutia.
Welcome to Choices to Benefit the Aging. I'm Joe Urrutia, Community Senior Service Coordinator for Choice Hospice and Home Health. Our topic today is, does your loved one need total assistance with activities of daily living? And our guest today is Willie Apodaca. She owns Loving Hands Foster Home.
Foster home.
Welcome to our program, Willie.
Thank you.
Willie, what is Loving Hands Foster Home?
Loving Hands Foster Home is a licensed senior home where we provide total care for our residents that come into the home. I have been there for 20 years now at Loving Hands, and the reason that I do have Loving Hands is because one of our family members, my father-in-law, had a stroke in 1990, and that is what opened the door to me to help others because of what we went through, the devastation it puts upon families becomes reality, and choices have to be made. And that's where I am now, 20 years later.
So were you his provider during that time, during his sickness?
Yes, I was. I learned to be a provider with the help of a home health agency that was sent to the home, to our home. And I was taught in the year that he lived how to take care of him 100%.
And then throughout the 20 years of working with different clients and different sicknesses that you've been able to understand their disease process and be able to provide good quality care through your experience working with home care agencies, correct?
Yes, yes.
And one of the things that I also find out about you, you're also a big advocate for not only home health, but also for hospice.
Hospice.
A lot of your patients, not patients, and I excuse that, a lot of your clients and residents that live in your foster homes they age in place, and if they are to pass away, they can stay there and die in the comfort of their home.
Yes.
At Loving Hands Foster. Is that correct?
Yes, absolutely. It's a home atmosphere. It's quiet and comfortable for the resident in the home, and we assist with everything that is in their needs. We work with hospice. We work with home health agencies, and that's been what I call team work, because without them, it just adds a little bit more, I'm trying to find the word,
quality
care to help with the resident.
And also to educate your staff on the
Yes.
disease process on
Yes.
these clients.
Yes.
I know our topic is today's when does your loved one need total assistance with activities of daily living? Well, when does a person come to a point and say, okay, I'm ready, I think I need help now, I can't do this anymore? When does that point come?
Well, the family finds out that there's devastation, and if there's siblings in the family that have to make the decisions on their mother or their dad being in this illness where they do need total care, there has to be one in the family that is going to make choices and let it go from there, because many of the family members do have jobs, they have families, they have children that they have to be with and take care of, and they have to have someone make the decision on what is going to happen with mom or dad. And when they make that decision, and they need to go and explore and find out where and what their needs are going to be to help take care of their loved one.
So basically, do you think that if you have a family member, you feel, okay, I can't take this, my loved one can't be left by themselves, go to work and I just feel that if I leave her at home, she's not taking her medications like she's supposed to. She's forgetting. You're afraid constantly that she's going to fall at home. She's not eating appropriately. Are those the things that you feel that people should start looking at that point?
Yes.
If you're going
Yes.
to work, or you know they're living by themselves, but you can't sleep and you're worried about, you know, what's going to happen to them being by themselves. Is that a point at that point, Willie, that they should?
They do need to make that decision there, because if they take a fall and break a bone, that's when the downfall goes. They have to go to a hospital, and when they're in a hospital, they start to decline as time goes, and they can't be left at home. They have to hire someone to come in to take care of that person. And then they find out that at times the person that they hired to come into their home to help take care of their loved one is not accountable
For that.
for that. And so they have to look elsewhere to place their loved one. And that's where the foster home comes in. They need to research different homes, because there are different homes, different ways that
And I agree.
people.
I agree, and I think that I have always told the public is that they always need to look at different foster homes and not just go by one. It's just the
That's
same thing.
right.
I think don't just
That's
choose
right.
one home health just because somebody told you, nor just one hospice. They all
Right.
really
You need
can.
to
they
investigate.
I think in the foster home setting, it is very different. You being in the industry and for 20 years,
20
you
years.
have a lot of experience. That makes a big difference right there. Also, one of the things I wanted to touch into is the assisted living. My experience in the past is that a lot of the assisted livings have been providing you, the foster home community, with those patients that are completely bedbound that they can no longer serve. And that is also a good option. Families that have a loved one in a
Assisted living, they can.
Have you found that,
They have
Willie?
guidelines, you know, and after a certain time, that when the person becomes more
needs
in
more
need
assistance.
of help,
Okay.
then they need to go elsewhere.
Do you
Or
find?
you can hire someone to be there, but they have to be there the 24/7.
And
or-
they're in charge of, the family member now again is still in charge of
Right.
making sure that these people are there, correct?
Yes. Yes.
Do you find in the industry that they do call you, coming out of assisted living, now wanting to place him in your
Not
foster-
as much in assisted living. No. I get more recommendations from hospitals, and hospice recommends families to us, and that's where I get a lot of my recommendations, and then from other families that I have worked with and helped with their family member in the past. Word of mouth is very good,
And your care.
and
I think the care
because
is-
we give the care that they need, and that is where we get a lot of our residents in. And of course, asking your doctor, asking him to recommend something for their family member, because they know the patient and the level of care that patient's going to need. And once they get past that, then they have to go and make that decision. And the foster home that I have, we have 4 residents in the home, not more than that.
Now, can the
And it's home atmosphere.
and I've been to your foster homes, and it really is. And I invite the public to go to Loving Hands Foster Home and look at this homes. And actually, they're in the historical area. Is that
Right. We're on Rio Grande
on
Street.
Rio Grande? What is the address?
919 East Rio Grande.
919.
That's where I started.
That's where you started, and you've done a lot of work to these homes and restoration of the home. Just kind of, it's a nice little community. It reminds me of when you're in San Francisco. Some of the homes that you,
Right, right.
even your own home, they all look manicured, and it's a beautiful. Just the homes, and they have private rooms.
Yes,
every
private
single room.
rooms.
Some of them have their own
Yes,
private bathrooms.
Bathrooms, and we do their meals. We
3
go
meals?
3 meals a day, and we help them kind of put the meal together, because we like to give the meal, as long as it's nourishment for them, what their likes and dislikes, and then you can present the meal that they would enjoy. And in your last years, you should be able to enjoy a meal. And
how about if it's a special required diet, Willie? Will you
we
be
follow
able, like a diabetic diet?
We follow the diet.
Okay.
What the doctor recommends, that's what we do.
So what Loving Foster Homes, Loving Hands Foster Homes, basically what you do is you do the complete care that needs to be,
yes, and we
keep
can,
that resident
right,
comfortable.
We can specialize their food, the way they like it.
Medications?
Medications, I administer the medications. I follow the nurse I usually work with a hospice nurse or a home health nurse, and we work as a team, and I do all the administering of the meds.
Okay. What else? Another thing. Now, if somebody again wants to come from they can call you.
They can call me.
What is the number they can call you at?
915-256-8356.
256?
8356.
56, and
Then
they
you
can make an appointment?
Make an appointment. I'll be more than happy to show the home. And there are no visiting hours set. You can come and visit at your time that you need to come. I have no rules whatsoever about limiting the time.
And I like
to
that,
visit.
Willie, because I have taken myself, family members out there that are looking at foster homes and taking them, or even to assisted livings where they're asking me, what do you recommend?
Mm-hmm.
And I've taken them, and I've had in the past my experiences that, well, these are the time frames that you can only come, and that family member is like, well, I work 8 to 5, and I want to be able to see my mom once I get out of work, and now they've closed the doors on me. And I'm now looking at it at the caregiver's perspective and the family's perspective. It's like, okay, I'm going to place her here, but now you've set boundaries on me.
I have
and
no
I like
boundaries. Yes, it's open. You can come and visit anytime. They're your loved one, and they deserve to have their family members around them when they want.
Do you enjoy what you do, Willie?
I do. I really do. Never in a million years would I ever thought that I would be doing this. 20 years ago, like I said, I started with my father-in-law with the stroke. Learning the process of taking care of an elderly one is difficult, and you have to take it really seriously. When he passed away is when I opened the doors for the foster home. And I've been here now for the 20 years assisting other families.
What is the longest patient you've had on your services that was?
I would say 13 years.
That long?
13 years.
Lived there?
Lived there.
And passed away?
And passed away.
In the comfort of their home?
Right.
And how was the family? I guess they were always happy with you? And
that's one thing you have to make sure that you do is get the family to feel that they trust you. I always say thank you for trusting me with your loved one. It's very essential that you have that bond, and it's very essential too for the person that comes in as a patient resident into the foster home, that they bond with the caregiver that's there 24/7, as well as myself. And once you get the trust and the bond, it goes very, very smoothly.
You know, you and I were discussing this earlier. In our community, in our cultura here, you have a very large families from 8 to 6 children, and it's very common where the decision is, well, who's going to make this decision, you know, and
right.
And who, you know, everybody kind of wants to see either it goes to the oldest one, and something that you say the bookend, or the person that is younger.
My brother and I, we were 6. My brother was power of attorney chosen by my dad. I'm the eldest.
But he was the power attorney.
But he was the power of attorney.
Because he was a caregiver.
Because he was the caregiver in the home. And keeping the others, everybody has their own minds, the way they want things done, or they don't agree with how you're doing one thing, and it causes a lot of ill feelings in the family, a lot of mistrust, and you just have to decide, okay, somebody's got to stand up and be the person that's going to make the decisions, and you go from there. And once you get past that, then it's okay. You have to get your siblings to trust in you and make sure that they understand this is for the good of mom or dad.
And it's usually, a lot of the times, it's the ones that are outside of the family, that they're within the family but live outside of El Paso. There's not a lot of rapport with their loved one that want to come in and make some changes.
Well, they don't know what's going on.
And what's really going on in
They
this,
have
the caregiver.
they have an idea that, okay, dad has got Alzheimer's or dementia, but they don't realize what it takes to take care of a person with that illness. It's a long, slow illness.
And it is, and not only since the illness, like you said, it's long and slow, and the impact that it has on that poor caregiver. And sometimes you find two caregivers,
Right.
brothers, brother and sister, or brothers, and you know, and they're the ones that are making all decisions. And then when everybody comes with a crisis, you know, these two poor people are left standing there, like, you know what? I've been making all these decisions, and now they want to come
Right.
in, and they have no respect. And something that you said earlier is that the ultimate goal is the one person.
The one person.
That's
what
the loved
you're
one.
there for, the loved one. And you have to, and it's difficult. It's difficult because there's emotions involved. And you've got to separate your emotions from making a decision. That is
And what's best for mom.
what's best for mom or dad in the house, you know, and you take charge, and you have to do it for their care, for their well-being. Even if it's deciding on what they eat or what they wear, there's always somebody that's going to bicker over something. They don't like this way, how this person's taking care of mom or dad, and they always seem to get involved, but one has to be the one that's going to stand and say, I'm in charge, and this is what I got to do for the love of my mother or the love of my dad.
You know, one of the things also is that you've had that experience. You lived it with your father-in-law.
Yes.
As a stroke diagnosis, right?
Mm-hmm.
And you went through the caregiving process and
I
learning
did.
and giving him his medications, and I'm sure you also deal with some family issues, people coming in from, you know, and stuff like
Right,
that. So
right.
you can relate to a family member when they come in and say, look, it's not, my mom is not the issue here.
Right.
The issue here is my other siblings and my other family members that are getting into the picture,
Right.
and now they feel they want to make decisions for me. Do you find that pretty common?
It's common, yes. I've seen it over the many years that I've been in the foster home. I was lucky enough to have
The support?
good siblings, yes. With my own dad and with my father-in-law, I had good siblings that backed me. We backed one another, and that is the only way that you can get through this illness to the very end, is having each other's back.
And I think it's in a time like this, everybody needs to come together.
They have to.
Either you're part of the problem, or
And
you're
it-
going to be are you going to be a solution, or I'm sorry, I'm going to say, are you going to be part of the solution, or are you going to be a problem? And part of that, you need to. Do you
And
think they
you-
should come with that mind frame?
And they try. They really do try. I've had many families come in, and they do try, but they can't accept that mom or dad is going to be going through a dying process soon, that they can't cope with it. And that's where my team comes in with hospice. Usually towards the end, it's hospice. And they have their team, the nurse, the social worker, the grief counselor, there's several people.
The aide also, there's
the
an aide
aide that
involved in
comes
the
to
process.
help. We're all a team, and we can sit down together and try to
Work out a
work
care
out.
plan.
Mhm.
Do you
We
think
have
so?
to have a plan for each resident.
Okay.
Each one is a little different, but in general, families have a hard time coping
And and I think with the coping process, I always tell people, you know, denial is just it's okay not to be in denial. It's just now we're there, like you said, the supportive staff to educate you on the disease process and what's going to happen. And I think once people are educated on that disease process, people are able to understand it. Acceptance is, you know, and accept it better. I think a lot of fear is based on no education about the disease process. Nobody's told him what is going to happen in this process, and they're just scared.
You can sit there and tell a family member what's happening and what your plan is to take care of them. But if they're in denial, there are a lot of families that I have worked with that have a person that's in denial that can't understand it. That's when you have to set them apart and try
and work with them and educate them. What do you think?
Yeah, you have to educate them and get them to trust you that you're doing what you have to do to help your loved one get through this. And trust is the #1 thing.
And I agree. And with your 20 years experience with Loving Hands Foster Home, it's you've worked with different clients with different prognoses.
Yes.
And with different, you know, diabetes is not new to you, not even stroke, from cancers to, I'm sure you've Parkinson's. You've worked with Parkinson's and dementia,
congestive heart failure,
your COPDers.
Yes.
So all these diagnoses are not new to you.
No.
I always, something that I always say in this program is, you know, you can be diagnosed tomorrow with diabetes and be in denial.
Right.
How do you move up beyond the denial? And you move beyond the denial through empowering yourself about the disease.
That's correct.
By being compliant with your medications. Don't let diabetes control you. You take control of diabetes through education, through compliance of your diet, doing your exercise, you know, doing the things that you need to do to take back control of the diabetes. Because if you let the diabetes control you, then it controls you by you not being compliant, not eating appropriately, not exercising.
Correct.
And I take that same mentality into the from the hospice also. Okay, you've been told this, and they were told, you know, your dad is COPD, now it's in its end stages. Or your dad has congestive heart failure, now it's in the end stages.
Right.
And these are the symptoms that are associated with end stages. So, you know, the denial part is now, that is where, since you work very closely with hospice, you did restorative care through home health.
Yes.
And you did the best that you could to restore them, to keep him healthy and give him a quality of life.
Yes.
And now you get into, do you agree with hospice is now, okay, the congestive heart failure has gotten worse. Now it's time for hospice.
Right.
And now let's talk about the symptom management of the chronicness that it's going to get to the progression it's getting, you know, that they might die of. And the denial comes in where your psychosocial teams, like you said, starts to educate them.
You
and say,
have
look,
to educate.
And with your experience, I think you bring a lot to the table.
When when a resident comes into the home, I usually do an evaluation before they're admitted into the home, because I need to make sure that I am able to take care of that person 100%.
And what is part of that evaluation?
And the part of the evaluation is just describing or trying to find out exactly what the illness is and focusing right there. Can I or cannot take care of these people? The person, if they have the dementia or the Alzheimer's, sometimes there's different stages that we have to go through, and there's a good time to make the move from their home and into a foster home. You have to be right on target there because of their agitation, their memory loss, they're confused, they're upset, they're angry. All this has to be taken in if I can place that person in the home.
And
with
what type
the
of
others.
activities of daily living you're going to have to provide yourself through your staff, right?
Right.
And through other resources that you can bring in.
Right. And I don't think I've ever, but maybe once, have had to turn away a family that I couldn't take care of.
And just because what, their level of care?
Their level of care, well, it was the anger management part that this person was going through. I had to be careful not to put them into harm's way, the other residents that I have there, because they can do things. You have to be watching them. That's why my caregivers there are trained, very well trained,
And they are,
to take
admit
care of these Alzheimer's or dementia patients.
You know, one of the things I always tell when I do take people to foster homes and assisted livings for them, I said, you know, some of the things I want you to look for, and it is important, is that smell the house. If
Yes.
it's clean,
Yes.
if it's the patients are the residents are clean, and if the facility smells good.
Good.
You know, all those little things you need to look around. Look in the bathrooms that they're handicap
Yes,
accessible.
yes, yes.
Is that correct?
Yes, correct.
Look at the staff and
Look
talk
at
to
the
the staff. How long have you been doing working with Willie?
Absolutely, absolutely.
and-
Look at their what I want to say. Look at the way they're dressed, the way they handle themselves, how they are loving to the person that comes in, because it's a hand on hand. You've got to always touch and hold hands, secure.
Okay.
Make sure
Sure.
that everybody is going to connect.
Connected. Willie, I want to thank you for being on our program.
Well, thank
and
you for inviting
all
me.
the information that you provided to us, and I hope that the public would call Willie.
Loving
at
Hands.
What is
I
your
love it.
number again?
At
256.
256-8356, and I'm on Rio Grande Street, 919
919.
East Rio Grande.
I want to thank everyone for watching us today. Also, if you have any questions regarding the hospice Medicare benefit or the home health from assisted living to foster home, please call me, Joe Urrutia, at 588-8382. I'm on call 7 days a week, 24 hours. I'm finding that there's a lot of families and caregivers out there in crisis wanting to know what is out there for their loved one, for their parents or their husband. Please, any questions that you have, I will connect you to the appropriate community resources for seniors and whatever I can do to help you. Again, thank you for watching Choices to Benefit the Aging, and God bless you.
Choices to Benefit the Aging has been brought to you by Choice Home Care and Hospice. For more information on this program, go to El Paso Southwest Senior Magazine at www.southwestsenior.com. Furniture provided by Copenhagen, 6550 North Mesa.